Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Shawn Needham, along with my producer, Lindsay, and we are streaming from downtown Boise, Idaho, actually Meridian, Idaho today. You guys know how much I love Idaho. Speaking of Idaho, we have an Idaho girl that's going to be on our show today. She is a physician's assistant from Spirit Direct Care out of Hayden, Idaho, and she is going to talk to you about her passions, which is lifestyle medicine and preventive medicine, and how she helps first responders and military, because she is a military person herself. So congratulations on that, Nikki, and thank you for your service, by the way. And Nikki, let's just go ahead and get started. Nikki, tell us a little bit about yourself and how you got into direct primary care.
So my name is Nikki Parquette, and I'm the founder, owner, and provider at Spirit Direct Care. We're just like every other DPC when it comes to membership-based, value-based primary care, except, I do things a little different with the lifestyle medicine.
So tell us about that. What do you mean by lifestyle medicine?
So basically, I kind of take an integrative approach and utilize all the resources that I have available, including the patient. So I have a partnership with my patients, and they're the experts on their body. And so combined with my education and my experience, we develop a plan together to get them healthy and to keep them healthy. And so we use those lifestyle changes and modifications first, as well as preventative techniques to try to avoid or decrease the use of pharmaceutical medications as much as we can. And so really we empower our members with their personalized care.
I love that, Nikki. Love what you're doing. One of the goals of our podcast is just that: educate and empower individuals to take care of their own health, because there really should be the main driver and be in charge of their own health. And so I really, really appreciate what you're doing. Thank you for doing it.
Absolutely.
So one of the reasons you have got a great background in many ways, and a great story about how you think there's kind of an injustice in medicine, and that's kind of why you went to direct care. Which, go ahead and explain. I know our listeners and viewers, we've had a lot of direct primary care providers on our show, but go ahead and explain a little bit what the direct primary care model is and why you got into it, because of what you felt as an injustice in medicine.
So it was when I started working as a PA on the civilian side. So I have a background in the military. But when I started working on the civilian side, it just became abundantly clear that our healthcare system needed an overhaul. Our system has become impersonal, expensive, and really just unsustainable. Patients, they spend too much money on subpar care. The providers are completely overwhelmed with unsustainable workloads, and insurance companies are interesting to work with. So I knew I could either keep banging my head against a wall or I could do something completely different. And so I went with let's do something completely different and opened up my own direct primary care practice. And it's really because nobody should feel like they are just a number, especially when they go to their doctor or their provider, or that they don't feel heard, or that they don't have a say in their care. People deserve superior care when they need it at an affordable price. And when I got on the civilian side of medicine, I realized that that just wasn't happening. And I couldn't think of any other way to make it happen without direct primary care.
You know, it's interesting you say that, and we've had some other direct primary care providers say the same thing, is that in order to change the system, you had to get out of the system, because it's just such a big monster that you can't really change it. So you did something completely different and got out of it, and now your patients are able to thrive, and you can work their way towards help them work towards optimal health. So thank you for doing that.
Wow.
You've got an interesting story, kind of. I don't know if this is straw that broke the camel's back, but you just saw, this was one of the stories that kind of made you realize the injustice in medicine when it comes to people not having insurance. And it was actually a personal experience with your brother. Will you tell us about how uninsured people don't get treated well? And I can tell you, I'm I'm one of those people because I'm not insured. So the first thing when I walk into a hospital or whatever, and they ask me about insurance and I don't have it, they look at me like they get a sorry face, and it's like, oh, I'm so sorry. And it's like, no,
Yeah.
this is great news. I'm going to pay you today, but they don't
Yeah.
understand that concept. So tell me the story of how your brother kind of had a horrible situation go on, and you think that he was probably discriminated against because you guys grew up in a poor family and you didn't have insurance. And tell us that story.
Yeah. So it was my brother-in-law, and it was well before I was into medicine. And so his father was really sick and did not get treated super well in my brother-in-law's eyes. And so he kind of always had this negative mindset when it comes to traditional healthcare and going to the doctor and preventative medicine and sort of all those sorts of things. And so when he had a pain or an issue, he would just pop some ibuprofen. And so he did that a lot for many years. And then he started having pain. And so he obviously didn't have a primary care provider because he didn't trust the system. And so when things started going kind of bad, he presented to the ER with this sort of vague pain. And this was, gosh, 20 years ago. So it was kind of at one of those times where ERs were getting in trouble and providers were getting in trouble for not addressing pain properly. And so they thought that he was more of an opioid pain medicine seeker. And
Mm-hmm.
they really didn't give it much more thought. They prescribed him, his 30-day supply of opioids and kind of pushed him out the door. And he was adamant about, no, there's something going on. But that, it just didn't work out. So the next day he got worse. He presented to a different ER. This was in a different state. This was out in the Midwest. And yeah, kind of the same story. And then, of course, now they look at him because he went to a different ER the day before. And
Mm-hmm.
so now he's doctor hopping and drug seeking. And so they, of course, gave him a couple more pills and sent him on his way. And so the next day, finally, I think that's when the straw kind of broke the camel's back, and he went to a different ER presenting with the same symptoms, just worse. And this time he jumped the border and went to Wisconsin instead of Illinois. And they did some blood work and they did some tests and showed that his H&H, so his hemoglobin and hematocrit, some of his blood levels were extremely low, and they started urgently giving him blood and plasma and all these different things. And they admitted him because he ended up having a giant duodenal ulcer that started bleeding, and he was literally dying. And it was an easy fix when it comes to fixes, I suppose. They gave him some blood and some medicine to kind of stop bleeding, and they watched him, and of course, stop ibuprofen
Mm-hmm.
usage. And so it was more a lack of education and a lack of access to care with somebody that he trusted. But it it really almost cost him his life. And the biggest part of that is, yeah, we grew up poor, and we didn't have insurance, not because it was a choice, but it was because we really couldn't afford it. And so when they looked at him, they thought that's what they thought. And it was just a really unfortunate situation. And so growing up with that and knowing that, I'm a healer and I want to help people, um, it was just part of that drive to make sure that, gosh, that doesn't happen to anybody that I'm taking care of.
And explain why that shouldn't happen when you're taking care of them.
So what I love about the direct primary care model is the fact that we have time and the ability to know our patients. And so if a patient starts to feel like something is off, we have the ability to be able to listen, and the time to listen. And it's our job as providers to be able to educate people. Um, I find that most of the time people they want to know what's going on with them in a deeper way, and I think that they deserve to know that. There's
And
something about having that relationship medicine, and being able to advocate for your patients so that they don't feel alone and that they don't feel unheard. And I think that that's what has been, unfortunately, removed from the traditional healthcare system, or at least maybe not as spotlighted, if you will.
so speaking of ERs and speaking of, a provider that they can trust, don't you have a story about a dad that fell down the stairs with his kid,
Oh,
that you can share?
so yeah, so one of the things that is, again, great about direct primary care is the availability that you as a member have to your provider. And so at Spear, we use a HIPAA compliant communications app. And so it makes it really easy for my members to get a hold of me kind of anytime. And they know if something is emergent, that they go to the ER, call 911 first, and then call me later, let me know. But if it's urgent, or they have a question or a concern, go ahead and shoot me a text or give me a call. So this night, it was a couple months ago, a dad and a kiddo, they were having a really great time. It was 6:30 at night. He was playing, he had kiddo upside down behind him, holding him by his ankles, and just having a really fun time,
That's just
and
what
was
dads.
going.
That's what dads do, right?
Right, exactly. And he wasn't even really, like, there was no rough housing. It was just, he was walking down the stairs, he slipped, and he tripped off the last stair, and fell. And it was just so heartbreaking because they called, and you could just tell that dad was so upset because I think this was, his first kiddo, first major oopsie. And so being able to come in and assess the situation remotely, be able to really dive in and do a remote visit and figure out kiddo is actually doing pretty okay. He looked like he got into a little bit of a bar fight, but it looked way worse than what it was. And just being able to support the parents and understanding that they're doing the right thing, being able to guide them to, hey, these are the things to look for. If you see these things, if this, then that, so if you see these red flag signs, then go to the ER, and call me anytime with any questions throughout the night. And then of course I scheduled to see kiddo in the morning, and he was doing great. And so being able to educate and provide peace of mind to that family was huge. Mom was starting a new job the next day. Dad had to go to work, so grandma actually brought kiddo in, and then they didn't have a big ER visit, and who knows, the testing and imaging that they would have done with
Right.
that. And so saving that time and money, and just that peace of mind that everyone was able to sleep a little bit better. Now, I don't know how much mom actually slept because, moms,
Right.
they are right over kiddo, making sure everything is good. But at least they knew that I was there. Somebody was watching, somebody was monitoring, even if it was from afar, and they had direct access to me anytime they needed. And of course, close follow up. Kiddo's doing great, and dad definitely. I don't think dad's gonna be on the stairs walking
Probably
with kiddo
not.
upside down anymore. Poor
He's
guy.
probably going to be a little bit apprehensive to do that. I'm sure he feels really bad. Well, what a great story, and I'm glad you were there to help navigate through that. And speaking of navigate, one of the things that you say that you do is, the healthcare system is convoluted. Even for healthcare providers like you and I, it can be confusing. So when a patient is trying to navigate the system, it can get kind of overwhelming. So speak to how you help patients actually navigate the system.
Yeah, so part of it is just knowing when they need to go to a specialist, being able to provide them excellent primary care. Everything starts with primary care, and unfortunately, we've gotten to a point where primary care in the traditional system has become just a referral source. So
Mm,
very little care happens now, and there's multitude of reasons that we could spend hours talking about as to why that is. And it's really not the providers. The providers, I believe, want to provide care, but they're locked into the system of
yeah.
just referrals. And so being able to provide that really superior, solid, foundational primary care, and then being able to make very smart referrals to specialists, smart referrals to imaging, so that when my patients or members go to a specialist to seek, kind of that next level of care, that specialist has everything they need to make a decision, or at least start making decisions and treatment plans for my patients. So it's not a wasted visit, because even, in myself personally, I don't know how many times I've gone to a specialist and they're like, oh, well, you need an MRI, or, oh, we need this test. And it's like, why wasn't that done beforehand, so that when I got here, we could make a plan, and it's taking time off of work and family
Right.
and whatever, to do that. And so I have a very strong relationship with the local specialists here in the Hayden, Coeur d'Alene, Post Falls area, so that if and when, because it's always a matter of when, you have to refer to a specialist to ask them, making sure that they have all the things that they need, so that the referral is in this nice, pretty bow, and it's wrapped up, and my patients are able to go and have an excellent visit, and we can get some answers and move forward. And that's huge. That's hugely important when it comes to, well, driving down the costs of healthcare, increasing the value, getting people healthy. I mean, the list goes on and on.
Yeah, it sure does. And speaking about getting people healthy, I know you talked earlier in the podcast about lifestyle medicine and people taking, a pill. So, but you can help them navigate that and choose a pill or choose lifestyle, and it's a very customized approach. Can you kind of give us an example of what you would do in a situation?
So, so again, in the traditional model, um, there just really isn't a whole lot of time to really implore and get people educated on lifestyle changes. Um, I think that providers try. It's always the first step. If you go to the American Heart Association, American Diabetes Association, all the associations, everyone, step one, lifestyle changes, reduce salt, decrease your weight, start exercising, sleep better. It's like, well, that's great, but how? How do we do that? And how much salt am I supposed to have in a day? And how much exercise am I supposed to do? For me, what
Yeah.
are the calories I'm supposed to be doing? Because I've dieted, and I've done calorie restriction, I've done keto, I've done all of these different diets. Nothing works. I gain more weight. Um, I eat just, I don't know, grass, and still my blood pressure is high and my cholesterol is high, and I don't know what else to do. And so really being able to have the time to be able to discuss with people and meet them where they are and say, hey, look, what are the things that you're willing to give up? What are the things that you're willing and able to change? How do we take a stepwise approach to make sure that I'm not just regurgitating a bunch of facts at you that you either don't understand or are never going to do? Then what's the point? We're wasting each other's time, and we might as well just do nothing. So it's better to meet people where they are, build a personalized plan of what, like I said, what they're willing to do, what they're not willing to do, and then get them hooked in with those professionals that know, went to school, are educated on that. I have a degree in exercise physiology. I've been an athlete my whole life. I worked as an exercise physiologist. I can run you through a program. I can build you a program. That was many moons ago. Lots of things have changed, and that's no longer my that's no longer my real specialty. But I know many people that is their specialty. So let's get you hooked in with those people. I can build you a calorie restrictive diet or help you with keto or the Mediterranean diet, but let's get you the books that are going to help you if you're a reader, or the videos that are going to help you if you're a visual learner, or people that we can consult with if you really need that motivation, and somebody kind of guiding you and even holding your hand through it to make sure that you stay accountable. If that's what you need and that's what's going to make you successful and get you to where you need to be in your health, then that's my job. I've done my job in being able to get you to where you need to be. And I'm not always the answer. It might be somebody else. It usually is somebody else. But it's my job to know where we can go to find reliable answers, how we build that program, and then to follow up to make sure, hey, are you missing something? Are you needing something? Where are you at with all of this? It's hugely important for me that my patients like they can talk to me about anything, that they can reach out to me at any time, because I truly do care. I want them to be healthy.
Yeah, and it's you talked about the system not having time to talk about lifestyle medicine, even though we all know it, every provider knows it. Like say the American Heart Association and the American Diabetes Association, they all say it, change your diet and all that. But I will tell you, it's so frustrating as a pharmacist because that's just not what happens with patients. Oh, you have diabetes. Here's a medication you can take.
Here's
And
all the pills.
right. And, I mean, on four, and then they just, oh, well, your blood sugars are still out of control. Here, we'll add another one. It's like, that's
Yes.
just, and, I said it on our podcast Monday, and I've said it over and over again, but I just, for type 2 diabetes especially, I just think that, lifestyle is so important. I don't think that medication is a long-term solution for type 2 diabetes. But we take things for granted if they don't, if they don't have a provider like you, walking through this process. It's like, well, you need to exercise, you need to lose weight. Well, yeah, how do I do that? I mean, to you got a background in exercise physiology, you know what to do, but patients don't. So it's good that they have somebody to educate them like you. So thank you for doing that, Nikki.
Yeah. And don't get me wrong, there is a place for pharmaceutical medications.
Absolutely.
There is 100% a place for that. And if somebody comes to me and says, listen, I want my Snickers, I don't want to exercise, I don't want to do any of those things, I just want a pill, I will prescribe that pill to you happily as per the standard and evidence-based medicine, and that is fine. However, you're in my circle, and I will gently nudge you into the direction of maybe changing a few things
Right.
so that maybe we don't have to increase dosing, or maybe at some point we can stop medication altogether. But if we need to start medication, and that is you're telling me as the patient, I'm not willing to lose weight, I don't want to give up a Snickers, and I just want the pill, I can do that too. That's okay.
Yeah.
I
And
would prefer
so,
that. Tell me.
right. I get it. And as long as you are honest and educate them, you're not as I'm a lot older than you are, so I've done this for a lot longer. So I unfortunately am not as politically correct as you are about that. And when somebody says, and a diabetic says, well, I don't want to give up my Snickers, this is what I would say. This is what I say now. That's fine. You don't have to give up your Snickers. You'll just have to give up your kidneys and eyesight. You just choose. You choose whether you want to give up your
Yeah.
Snickers or your kidneys and eyesight. Because if you keep eating like that, you will give up your kidneys and you'll give up your eyesight. It's your choice. And then that kind of hits home. Some people don't like my answer like that or like how I say it, but it's true. And I've heard of dietitians that will tell, kids that are diabetics and they're type 1. And it's like, well, we can't deny these kids birthday cake. Well, okay, then we can deny them their kidneys and their eyesight. I mean, and I'm not saying that every once in a while we can't have that, but if you look at what's happening in America, diabetes is it's a epidemic, a pandemic, and it's not getting better. So we just need to be honest with patients and just stop being nice about it and saying, oh no, it's okay, you're just a few pounds overweight, but we'll give you some medication, it'll be okay. No, it's not. You either change your lifestyle or you lose your kidneys and eyesight. It's up to you.
Oh, absolutely. And so you're right. I'm being politically correct here. And as my patients and friends and family will attest to, or basically anybody who has met me and knows me, I can be very harsh and bold and just flat out uh, telling people exactly how it is. So
That is true. I will attest to that. That is true of you, Nikki.
So I don't sugarcoat things and I don't lie to people, and I expect the same, because honestly, we can't have an honest conversation and make any real change if we're dancing around. Oh well, I swear I'm gonna take my
Yep.
medicine, or I'm gonna do. Oh, I'll give this up, or I'm gonna really work hard and lose that 5 pounds. No, just tell me you're not gonna do it, and we'll make a different plan, because the idea is we have to save your kidneys, we have to save your eyesight, we have to save your toes, we have to save your heart. I mean, and so part of that is, like you said, it's really educating people the consequences. If this,
Absolutely
then
right.
that. If you continue to do this, this is America, and if you want to do, if whatever you want to do, that's on you. I'm not here to judge. I'm not judging your lifestyle choices in any way. I just need you to be honest about them with me so we can build a plan that's going to work. Because if you're under my care and we're losing kidneys and toes and eyesight, then something has gone horribly wrong. And that's just not okay. And I've failed you as an educator and as a provider, shoot, as a human being, because that's just, oh man. And don't get me started on diabetes.
Yeah, no, I love it. And, I mean, obviously I have a passion for this subject. And I think, you already hit it on it early on in the podcast, is that in general, it's a system problem. And, I wrote a book on it, and the book is called Sickened: How the Government Ruined Healthcare and How to Fix It. And there's a 6-step solution in there about, how to fix the healthcare system. And the first solution is patients need to take charge of their own health.
Absolutely.
They need to stop washing their hands of it. They need to stop looking for a pill to fix it. They need to be in charge of their own health. A quote in the book from chapter 6, where I go through the 6-step solution, is a quote directly from me, and it starts out like this: the best health insurance we have is not some plan that we can buy. It's how we take care of ourselves. Period. There is no better health insurance than how we take care of ourselves. No fancy insurance plan is gonna take care of our health. Period. We
Preventative
yeah
maintenance.
yeah we have to
Exactly
be
right.
proactive. Right, we have to be proactive in our health, and we do need people to help us along the way, like yourself. So that's awesome that you're doing
Yes.
that. So
Yes.
thin
Thank
blue
you.
line benefits. You're welcome. Thin blue line
Yes.
benefits. Tell us a little bit about that.
So I love all of my patients. I do. It's truly my honor to take care of all of them. I love them all in my own way, for different reasons. But my heart really goes out to the first responders and military, personnel. So fire, EMS, and service members. It really is my passion to take care of those that take care of us. They're willing to sacrifice and place themselves in harm's way to keep us safe. And I feel like it is my duty to help them stay healthy, get healthy, stay healthy, so that they can work at the top of their game. And what I think is really amazing is most departments have super great healthcare. They've got great benefits, health insurance, great availability. The culture is such that if you're sick, you go in and get seen. Especially now with COVID, that really changed the way that employers look at how illness can go through as an office or an agency. So that's super important. But what happens when these people get out of that lobbied, secured benefits, and they're retiring maybe, and they're not of age to get Medicare, so they're younger than that 65, and they're used to having superior benefits? There's this gap. And so they go out for the first time and they try to get health insurance, and it's thousands of dollars literally to cover themselves and their family. And now they're retired. So maybe they're on a pension, maybe they're on a fixed income. Maybe they don't want to go back to work and start up a secondary career. And so what the Thin Blue Line Benefits Association has done is they've put together a package, if you will, that incorporates a direct primary care membership with a health share, and I think there's some prescription medication benefits, some lab benefits, and they've rolled it all together and made it available. Yep, there it is. Made it available for
Thank you, Lindsay.
active and retired. Yeah, thanks, Lindsay. First responders. And so they've actually also opened it up to military personnel as well. So it's a huge thing. TRICARE for a family is like $230 a month. If you try to find something like that in out on the open market, it's for a family, it's $1,300 to get, and it's not super great insurance, meaning that you have a really high deductible, so you're paying out of pocket for things. Maybe some providers and doctors don't actually take that insurance. And so this group put this together, and it's absolutely amazing. And of course, it falls directly in line with my passion of wanting to take care of the people who take care of us. So I'm obviously a part of it. I would love for people to reach out and ask for more information about it. I think that it's absolutely, it's amazing.
So we're getting ready to end our podcast, and I was going to ask you what your passion is, but you just said it.
Boom! That is my passion.
Bam.
Oh my gosh. It's literally the reason I joined the military. It's the reason I stay in the military. It's the reason that I opened up this practice. That is it. That my passion is really to provide easy access to superior care when you need it at an affordable price. It is just that simple. And then, of course, my love for our service members and first responders.
Well, thank you for doing this, and thank you for your service, Nikki. You're really you're inspiring and encouraging others, and I really, really appreciate that. So we need more of you in healthcare, that's for sure.
Thank you.
So, Nikki,
thank you so much for having me on today. I appreciate it.
How can people get a hold of you?
Yes. So I have a website, speardirectcare.com. That is the easiest way to get a hold of me. You can call. There's a phone number there. You can email me. I don't check my email as often, but I will definitely get it. Or you can just text. That's probably the easiest. If you want to sign up, go to the website, scroll about 3/4 of the way down, pick which plan fits you, and sign up. Everything is automated. It's really, really easy, streamlined, amazing.
I love it. I love it. You make it simple. I love it. Well, Nikki, thank you for being on today. And as always, you can catch us, Health Solutions with Shawn and Janet Needham, every Thursday at our midweek podcast, 8 a.m. to 9 a.m. Pacific Standard Time, and Mondays, 1 to 2 p.m. Pacific Standard Time. Speaking of Mondays, this coming Monday, you do not want to miss out. Dr. Pran Yoganathan is going to be on our show. He is a gastroenterologist. He's going to be our first international guest, all the way halfway around the world in Australia. He is going to be talking on the carnivore diet. And as you guys know, when it comes to carnivore diet, a lot of the questions is, well, wait a minute, don't we need fiber? Aren't we going to get colon cancer if we don't have fiber? Well, we're going to have a gastroenterologist answer those questions, along with a lot of other GI problems, like Nikki was talking about, how we prescribe drugs for many different things when it could be diet and lifestyle. You might be surprised how many drugs could be could be discontinued if patients change their diet. So you don't want to miss out on that. Stay tuned Monday, 1 to 2 p.m. And as always, thanks for tuning in. Check us out on YouTube, the Moses Lake Professional Pharmacy YouTube site. Also, your favorite podcast forum. Like, subscribe, comment. Let us know what you would like to hear, and we'll get back to you. And we would love to hear your comments. So let us know. Thank you for tuning in. Health Solutions with Shawn and Janet Needham.